Patient assessment, management, trauma. Takes or verbalizes appropriate PPE precautions. Determines the scene situation is safe. The scene is safe. Determines mechanism of injury, nature of illness.
Hi, ma'am. My name's Connor. I'm with the fire department. What seems to be going on today?
My arm is bleeding.
Okay. All right. Let's go ahead and get that bill. Stop.
Determines the number of patients.
One patient.
Requests additional EMS assistance if necessary.
Not at this time.
Consider stabilization of the spine.
Did you fall and hit your head or hurt your back at all?
No.
No. So no C-spine needed.
Verbalizes general impression of the patient.
Patient is sick.
Determines responsiveness, level of consciousness.
She's talking to me. Hey, do you know where you are right now?
Yeah, Tri-Cities.
Okay. Who's the president?
Trump.
How many quarters make a dollar?
4.
So she's saying no times 3.
Determines chief complaint, apparent life threats.
Okay, so she's got a cut on her arm. We're dealing with that now.
Not too tight.
Is there anything else going on right now? Do you have any cuts anywhere else?
No.
No, that's just the arm, yeah?
Yeah.
Okay.
Airway. Opens and assesses airway. Inserts adjunct as indicated.
Okay, so no adjunct needed. She's talking to me. Her airway is open and patent.
Breathing. Assesses breathing. Assures adequate ventilation.
Yep, I got mine.
Initiates appropriate oxygen therapy. Manages any injury which may compromise breathing ventilation.
So she's got no other injuries. I'm seeing equal rise and fall of the chest to show me that she's getting good ventilation. We're going to put an SpO2 on her. We'll get her oxygen sat here in a second. If it's lower, then we'll get her on some oxygen.
Okay, sounds like a good plan.
Circulation. Checks pulse. Assesses skin. Assesses for and controls major bleeding if present. Initiates shock management.
So she's got good pulses. We got her bandaged up for her cut. We're not going to do shock right now.
Identifies patient priority and makes treatment transport decision.
We're going to go ahead and get her in the back of the truck right now.
Obtains baseline vital signs.
We're getting vital signs right now. Her SpO2 is 99% and her pulse rate 65, so 99% with the SpO2. We do not need to put oxygen on her.
Attempts to obtain sample history.
Okay, ma'am, so I got a couple questions for you, okay? Are you allergic to any medications?
No.
Are you on any medications?
No.
Do you have a past medical history?
No.
Okay. When was the last time you ate or drank something? What was it?
Sandwich.
How long ago about was it?
3 hours.
Okay. And what were you doing to have this happen to you?
I jumped a fence.
You jumped a fence. Okay.
Head. Inspects and palpates scalp and ears. Assesses eyes. Inspects mouth, nose, and assesses facial area.
So while I'm here, do I see any fluid coming out of the ears, the nose, the mouth?
No.
Okay. Her eyes. Go ahead and look right at my forehead, okay? Eyes are pearl. Any pain up here in your forehead?
No.
How about down here in your cheeks?
Uh-uh.
How about down here in your jaw?
No.
Perfect. Any bleeding from the head right here?
No. Neck. Checks position of trachea, palpates cervical spine, checks jugular veins.
So no JVD, trachea is in line. Any pain back here when I touch the back of your neck?
No.
No? Okay, so she's good back there. No blood either.
Chest. Inspects chest, palpates the chest, auscultates chest.
Okay, so when I'm done palpating
Yeah.
the chest, go ahead and
I
get
listened to
some
lung sounds, they are clear.
Perfect.
No problems.
No pain in here?
No.
Perfect.
Abdomen, pelvis. Inspects and palpates abdomen. Verbalizes assessment of genitalia perineum as needed. Assesses pelvis.
Okay, so any pain in your ribs right here?
No.
No? How about in your stomach?
No.
No? Any pain in your pelvis?
No.
Okay, you're good? No reason to check the genitalia?
Lower extremities. Inspects, palpates, and assesses motor, sensory, and distal circulatory functions.
Okay, any pain in your leg right here?
No.
Blood? Alright. Got good pulses. Pull up on my hands. Push down. Toes am I touching?
Big.
Perfect.
Upper extremities. Inspects, palpates, and assesses motor, sensory, and distal circulatory functions.
Alright, any pain in your shoulders here?
No.
No? Any pain in your arms?
Uh-uh.
Okay. Reach over, check this arm for you. Any pain in there?
No.
No? Pain in the shoulder?
Uh-uh.
Other than the cut right here, is everything good? Okay. Go ahead and squeeze my fingers for me. Perfect. Check your pulses here. Got good pulses. What fingers am I touching?
Pinky.
Perfect.
Posterior thorax, lumbar, and buttocks. Inspects and palpates posterior thorax. Inspects, palpates lumbar and buttocks areas as needed.
All right, let's go and roll her over, okay?
Yep.
1, 2, 3. Hold it right there for me. Alright, any pain in your back here, ma'am?
No.
No. Spine's in line. No bleeding. Everybody's been checked the buttocks, the legs are good. No bleeding, we're all good.
Manages secondary injuries and wounds appropriately.
Didn't see any secondary injuries other than the cut on her arm. She's good to go.